Hey folks, Dr. Gerstmar from Aspire Natural Health, and in this quick video I want to talk to you about how to take probiotics with antibiotics. Now this really breaks down into two questions. The first being, should I take probiotics with antibiotics? And the second one is, when should I take those probiotics? Should it be when I'm taking the antibiotics or after the antibiotics? I mean, when and how should I take these things? So let's tackle these questions because they are important. The first is, should I take probiotics with antibiotics? And the answer is absolutely yes. I've seen plenty of people come into our practice because they've taken a round of antibiotics and it just devastated their gut and kicked off health issues for them. The issue here is that antibiotics are not very selective. Yes, they go after all or most of the bacteria, the bad ones we want to get rid of, at least when they're working right. But, and here's the problem, they also go after the good bacteria that we want and need to keep. Now, the science shows us that some people's microbiomes, that is, the beneficial bacteria we have on and in us, responds easily to antibiotics and springs right back. So some people take it, they have absolutely no problem, it just springs right back and they don't even notice a thing. But the science also shows us that some people's bacteria are hurt by this and never recover afterwards. And some people, it gets even worse and their bacteria are just devastated and they never recover properly after that. Now, other than trying to avoid antibiotics unless you really need them, so please don't take antibiotics for every little sniffle or issue that comes around. They really are powerful medicine and we want to save them for when they're most necessary. So other than trying to avoid antibiotics that you might not need, the other thing you can do to protect yourself is to take probiotics. So, should you take probiotics with antibiotics? Absolutely. The fact that MDs still routinely give antibiotics without giving probiotics puts me in fits of rage each time somebody comes in. Their health has been messed up because of this. It's so simple and easy to do. So now that we have the answer to the first question, let's answer the second question. When and how should I take the probiotics? I see some people out there saying, well, hold off on your probiotics until after you've finished the antibiotics, because after all, the antibiotics will just kill off the bacteria anyways, right? Makes sense. But taking probiotics after a course of antibiotics is definitely better than nothing. But we have studies that have already answered this question for us. The best way to take probiotics to protect your gut from that antibiotic-induced damage is to take the probiotics with the antibiotics. So we have people begin taking probiotics immediately the same day they start any antibiotics. Now, it's best if you can space out or take those probiotics as far away from the antibiotics as possible. For example, if you're taking your antibiotic with breakfast, then have your probiotic with dinner, etc., right? So we want to try and space them apart from one another. But I'd rather see someone take probiotics, even if they have to take the probiotic and the antibiotic in the very same mouthful, rather than not taking them at all. So the most important thing is to get the probiotics in, and if you can, space them away to try and reduce any damage that the antibiotic does. The science shows us the best way to prevent that damage that we've been talking about to our gut bacteria is by putting these probiotics in at the same time as the antibiotics. Now, the last question that we do get asked is it okay if I use fermented foods like a sauerkraut or a yogurt instead of taking probiotic pills? And the answer is, if it's real, live, fermented food, that should work. Now, what we usually do is to use a probiotic supplement because we know exactly what it contains and how much is in there instead of or in addition to fermented foods. And then after the course of antibiotics is over, have people continue with the fermented foods from there. So there you have it. Should you take probiotics with antibiotics? Yes, yes, a million times yes, please. How should you take them? Take them both at the same time, preferably as far apart from one another as you can. All right, folks, if you or anyone you know is dealing with irritable bowel syndrome or IBS, I'd like to offer you an expert guide on how we treat and help people with IBS here at Aspire Natural Health. All you need to do is fill out the short form below, and we'll happily send that to you for free. So please click on the report down below. At Aspire Natural Health, we are experts at treating digestive issues and autoimmune diseases. If that's you, we'd love to connect with you. We offer a no obligation, no pressure chat to see if we can help you and if we're the right fit to work together. If we are, we'll move forward, and if we're not, that is okay. We'll do our best to connect you with the person who can best help you. You have nothing to lose, so please call us now at 425-202-7849 or email us at info@aspirenaturalhealth.com. Until next time, folks, take care.